My name is John Deeter, and I'm 75 years old. I enjoy all kinds of athletics: biking, swimming, running, mountain climbing. I started to have pain in my right knee. My back started bothering me. My leg actually kicked outwards. I was starting to get bow-legged, and that affected my running gait. I had pain probably for 4 or 5 years before I went and saw a doctor.
I'm Dr. David Miller. I'm an orthopedic surgeon with Ortho, Virginia. I have been working here at Chippenham for the last 18 years. The orthopedic service lines here for Chippenham include pediatric surgery, sports medicine, hand and upper extremity. We support the trauma program here because Chippenham is a level 2 trauma center, as well as what I do, which is joint reconstructive surgery.
When I went, he, diagnosed that I had some meniscus damage in my right knee that was causing the pain.
Came to the point that we knew that we weren't going to be able to get him doing the things that he wanted to do without surgery. And that's when we planned to do a partial knee replacement. A robotic arm helps me to uniquely implant the components based off of the patient's anatomy. We virtually place the components in surgery, and then we're able to take that and reposition it based off what your natural soft tissue balancing is, so that we can more accurately place the components, make it feel more normal and natural to you.
The surgery process was very smooth. My improvement started almost immediately. I only used crutches for about a half a day. In about 2 to 3 weeks, I could do about anything I wanted to do. I'm happy that I can walk normally and walk distances again. My back hurts less. I think I'm walking straighter. I've done the Richmond Marathon every year since it started, and I was able to complete my 40th one this year, so that was sort of a goal of getting my knee done, that I could keep doing that.
I think he'll be able to continue to do what he wants to do, not limited by his knee.
The quality of my life after the procedure has probably increased 80%. Just generally, I think I feel better about myself.